Good afternoon, and welcome to our July Dementia Dialogue, part of a series entitled Sentiments and Situations Requiring Solutions. This month, we address an important topic about your role as caregiver and how it changes when your person moves into a retirement community. It's my pleasure to introduce our presenter today, Lori Nissen. Lori is the Director of Family and Community Services at Banner Alzheimer's Institute and Banner Sun Health Research Institute. The Family and Community Services team provides a model of standard care designed to better meet the needs of patients and families coping with challenges surrounding Alzheimer's and other progressive neurodegenerative diseases by offering opportunities to live more successfully through outreach, support, counseling, and education. Please welcome Lori Nissen.
Thank you, Heather. So I'm really pleased to be able to talk with you about how your role might change as a caregiver as your person is placed in residential care. And we're going to really focus on how to focus on being that person's advocate, even though they're no longer at home with you. And so really my goal here is to have a conversation with family caregivers of folks with dementia who are really kind of challenged with role changes and loss that really comes with that transition to a residential care community. I want to cover really what the role of advocacy means, talk about different factors that led you as a family to consider placement, also talk about aspects of the caregiving role and how that role changes and modifies when the person is placed in a residential community. And then, of course, really address some of the strategies that you as a family caregiver can use to really help you manage this transition more effectively. So what is an advocate? I mean, really an advocate by definition is somebody who pleads the cause of another person. And so with a family or a care partner of somebody with dementia, we're really talking about your role. You know, maybe you spent several or many years caring for the person who has dementia. And little by little, your role has become blurred. Maybe you were a daughter, a sister, a spouse, and now you've moved into that phase where your primary role is caregiver. And you've really become adaptable in figuring out daily routines, locating resources you needed, assisting with difficult activities like finances, accompanying that person to medical care appointments, and also finding activities that person can really still participate in and enjoy. And all the while you're, providing a lot of hands-on care as well as promoting that person's safety. But you have become your person's advocate. And so as this role changes from the primary care provider, really the shift moves from being kind of in charge of all those daily details to maybe that of a supervisor or supporter. Many advocates are advocating for legislation through advocacy, or even publicly recommending support through the Alzheimer's Association causes. But in this primary role as advocate of your person, you're really their advocate and supporter as they move into a care community. So what does that mean? I mean, dementia creates lots of life changes for the person with dementia, but also for the caregiver. I mean, you've really become that voice of the person with dementia as their memory fades and they're relying on you to become their memory, if you will, and really their advocate. And advocacy isn't a clearly defined role, right? It changes over time and character as needs arise. It may occur really without the knowledge of your person, or more formally as being identified as the power of attorney, or even in some cases the guardian. As a caregiver, you have become your person's advocate, making decisions with them, or in some cases for them as memory fades. But you're handling a lot, lots of household and personal responsibilities, legal, financial, and maybe employment responsibilities, You're managing all of the chores, activities, and trying to maintain those social connections as best you can. And, really trying to maintain a sense of your own family and traditions, trying to make accommodations and adjustments, maybe providing a lot of hands-on personal care and overseeing the safety of that person, anticipating their needs. And as this person in their state of dementia moves into a residential community, you're really becoming a spokesperson for that person, not just who they are now, but kind of their whole life story. And so there are days when caregivers talk about feeling really on top of everything, and then on other days feeling just a lot of overwhelm. So how does becoming a caregiver really affect you as a person? I mean, it brings about and triggers a multitude of emotions. Caregivers often speak of the loss of the relationship, maybe being the one who cares for the person with dementia, but as dementia causes that person to be less emotionally available, really feeling that the reciprocity of that relationship has changed. So there is, some sadness or grieving on those, changing relationships and changing expectations, as well as the losses that continue as the person with dementia fades and declines. Some ambiguity, even if you've discussed lots of plans for the future care needs, things arise and there's ambiguity. What would my person want? What would he or she do? And then how do I make that decision? And maybe some frustration in being mindful of words and knowing that, there are days where there's a lot of frustration, but having to find other ways to release those feelings so that it's not on the person that you're caring for. And then, maybe some anger and resentment in the increased care load and your life not appearing as you thought it would at this phase of your life. But then some pride, in learning new skills and recognizing that as a caregiver, you have amazing abilities, you are resilient, you're strong, and you find creative ways to manage, day-to-day challenges that occur. But also being aware that those subtle role changes occur. You may have begun as the adult child and you start feeling like the primary caregiver, maybe almost as if you're the parent and the person you're taking care of seems more childlike. And so that can be really difficult to manage. And so with the change in the person living at home and moving into an assisted living community of some kind, often the caregiver can go back to their original role and really move from being the primary caregiver, as we said, to really being that advocate. So we know as the disease progresses, over time, responsibilities increase. When we think about dementia progression on a graph, as we see that long, slow decline of cognition, memory, thinking, recall, there are changes in mood and personality and behavior, as well as the decline in that person functionally or physically. So where originally it's lots of prompting and shaping of the day, now as the disease progresses, we're really looking on lots of hands-on care needs and physical challenges like falls, maybe incontinence. And so caregiving for somebody with dementia can be more intense than caregiving of other illnesses, as this person may not recognize that they need help. Because of the apathy and, possible lack of insight into the disease, the person may appear unaware of their needs or even unappreciative because of the way the disease affects their brain and ability to have insight and empathy. And so these issues, the behavioral changes, the emotional impact, Sometimes support is very limited. Family and friends may be supportive verbally, but not really providing any available hands-on help. And because the person with dementia may become more socially withdrawn, that affects you as the primary caregiver, and often those social connections decline or recede. Social workers and nurses and medical professionals are telling you just get some in-home care, get some respite. But we know that many of those resources become incredibly expensive, and that financial aid is often limited. So because of all of these factors and many others, these are the things that kind of build up like a storm, if you will, and are often triggers to residential placement. So as the disease progresses, you find yourself making more and more decisions for your person. You really become in charge and try to make the best decisions possible for the person with dementia. Other people involved may not recognize how much you're really stepping in and how difficult these decisions can be, whether they're legal or financial, whether related to medical care and treatment. Choices about outside care and when is it time to really implement those. Adjusting the day-to-day routine to make sure that there's enough structure for your person, and really working hard to keep some of those social connections going. That can create a lot of stress on the person with dementia as they're less able to participate in those decisions and may feel like you're taking over some of the control of their life. And that can be very difficult for the person with dementia. And of course, it's difficult for you. So as that person continues to decline cognitively, maybe emotionally, your responsibilities as a caregiver rise, as do the feelings of pressure and overwhelm. So you get down to really thinking about decisions. What would my person want? And does that really meet my needs? The person may have said that, it's really important for them to stay at home. Maybe they were thinking permanently, and maybe you're thinking that that's a good idea as well until you get down to the details of managing all the care yourself. So caregivers are often, wonderful at taking care of their person, but often have a really hard time balancing their own needs and also navigating the resources that may be available to them in the community. So you think about, maybe implementing care in home. How will I do that? Will other family members or, friends of the family step in to help? And then negative feedback. Sometimes you're doing such a good job of covering for that person's deficits that people around them don't realize how much help you're really providing, and may not recognize that when you're hiring outside help or looking at residential care, that you're really at the point where you probably should have done that quite a while ago. So being aware of the fact that maybe you made promises that weren't so realistic to keep, and really having open conversations to get family and close friends on board, maybe calling a family meeting if necessary, and then relying on experts to make sure that you're implementing care when you need it, and involving care providers and experts and the medical team and social worker and nurses, for example, can really help you feel better about your decision and also act as a buffer between you and extended family members who may not be as supportive. So you put it off as long as you can, but then you really start to realize it's time. Is it time quite yet? Can I hold off a little bit longer? Is my person really as bad as you're saying? They really don't need as much help as you're saying as the professional. But then when you take a step back, are you really adding up all of the things that you've really taken over? We know that most caregivers often place their loved one much later than is recommended because they're really working hard to take care of that person as best they can. And they have these ideas like, well, I really should wait until my person doesn't recognize me at all, then it really won't matter. Or feelings of guilt or feeling selfish. Am I violating my wedding vows or the promises that I made? Am I trying to avoid responsibilities? And how will people around me recognize that I'm really doing what's in the person's best interest? And then that idea that, knowing that the care that I provide is exemplary. It's never going to be the same provided by someone else. And will my person, feel that I'm abandoning them? Often caregivers are providing care at the expense of their own health. It may be affecting their own relationships or marriage, and creating problems for them if they're working. And so really trying to balance all of these different variables and making the right decision can really be quite overwhelming at times. And then a crisis occurs. Often the caregiver injures themselves or ends up in the hospital with cardiac event or some other healthcare crisis. And then we are having to make this move without a lot of thought or preparation. Many caregivers talk about the high level of stress and burden, but many actually suffer from, an actual clinical depression where they're having, periods of really sadness and low mood, maybe anxiety. Maybe their person is sleeping okay, but they're really having a hard time adjusting to that sleep pattern and getting the rest they need, getting into bed and having those racing thoughts about all the things I didn't get done today or how will I manage tomorrow. Changes in appetite and concentration, some of those physical symptoms of fatigue, feeling run down, restless, having trouble even when I get breaks of enjoying myself, or maybe having trouble coping with my feelings and instead using alcohol, drugs, or extra medication to really manage my pain. Or maybe I'm having somatic pain, some physical symptoms as a result of depression or caregiving, maybe back pain. And then, as things maybe aren't getting better or I'm not seeking help or support, thoughts that life isn't worth living. And so these things really need to be considered critically, and recognizing that, there isn't a perfect time for placement, but it was probably time 6 or 12 months ago, but I've just been ignoring or failing to see the signs. So you start looking at communities, lots of options, which is a blessing and a nightmare at the same time, right? Because you want to have choices so that you can make sure you find the right place for your person that's going to be a good fit. But, if you're in a metropolitan area like we are here in Phoenix, if you looked at every facility, it would take you months. So, and do I know that my person really needs assisted living? Or how do I know if they need an assisted living with memory care? Or is a group home or adult care home better? Or do they need a higher level of care, like a nursing home? And so each have different types of help and different expectations about what they'll provide. And just like you may be experiencing some feelings of remorse or guilt about seeking placement, sometimes that leads to us selecting an environment that is less than my person needs rather than an adequate amount, as we want to try to start people at the lowest level of care possible. On the other hand, we want to make sure that we're moving them into the right community that has enough care to sustain them so that we're not setting them up to fail. So how do you do this? Well, you can certainly do a search on your own, but it may be that you really are looking for someone knowledgeable, an advocate who can really serve to guide you in your search. Maybe you're starting with your local area agency on aging, or the 1-800 number that the Alzheimer's Association provides to provide support and education and resources for you. You may have access to a professional at your medical provider's office. Maybe it's a care manager, a case manager, social worker, or even nurse. And that's a really good place to start. If you haven't joined a support group, that's often an excellent way to get support for yourself, but also to learn about resources from folks who are in similar shoes. They might be able to say, I tried residential care center ABC, and I just really found that it just wasn't a good fit for my person for these reasons. But when I went to residential care DEF, they did a great job and was a perfect fit, and this is why. And so often hearing from someone who's experienced that situation can be very helpful. But you definitely will need some kind of help or support to sort out those choices. In many communities, there are placement agents who are kind of like realtors. They get paid by the various communities that they contract with once your loved one is placed in that community. So they can help with the selection process, but be aware that they do charge the facility where you placed your loved one a fee. So you find a facility that might work, but then something happens. The transition just doesn't go as smoothly as you think, or the administration tells you things that you weren't aware of, like we really want you to step away for 3 or 4 weeks so that your person can really adjust well to our community. That's always seems to be a red flag for me, having those strict rules, because I think each situation is really unique, and having a strict rule without any visits can be very counterproductive. It creates a sense of anxiety and worry for you, but then the person who has dementia is feeling abandoned as they make this move, and we're setting them up to reinforce that abandonment by not permitting any visits. So making sure that you're aware of those kinds of rules before you move someone in. But if that does pop up when the person's already in the facility, in creating a necessary meeting to discuss those factors and what's going to be best for your person is important. Maybe the charge nurse you thought had lots of training in dementia tells you that really her best training is because her mom has the disease. You saw a whole list of activities posted on a monthly bulletin board, beautifufully done, except when you go to check on the activity, you're just seeing television provided. Maybe in the lobby there, is a waterfall or chandeliers and beautiful furniture, but once you move past that into the community where your person actually resides, it's less desirable. And there are inflexible rules about, when that person eats or when that person sleeps, or the staff seem, distant, looking the other way, not making eye contact. Or you've made suggestions about your person's needs and you don't feel like the staff are really taking that into accommodation. Those are signs that you might want to look elsewhere. However, remembering that no facility is going to provide care the exact same way you did, and probably not as well as you did. And so recognizing this is a different setting, but trusting your gut. If the facility and community's ideas and culture don't fit yours, you probably should be looking further. Incompatible rules and restrictions can really increase your stress, but also stress on the point of the person with memory loss. On the other hand, making sure that you're being as honest about your person's care needs before they move in, because you don't want to set your person up to fail. If your person doesn't sleep well at night or is having some behavioral changes as a result of their dementia, being upfront and honest with the community about those and asking them ahead of time how they might handle them, so that when your person arrives and has those problems, they're not quick to say, we're not equipped for this and this isn't going to be a good fit, because multiple moves is going to be incredibly stressful for your person and, of course, for you as well. So when you're looking for care options, think about a place that is convenient for you, a place that you can visit make sure that you visit several centers and you keep notes so that you're comparing and contrasting some of the strengths and weaknesses. I always tell people that it's fine to meet with the outreach person or the marketing person on a first visit, but then stop back in kind of randomly to see how things really are when there isn't a dress rehearsal, if you will. Using your senses is going to be helpful as well. What do you smell? What do you hear? What do you see when you walk in? Ask a lot of questions to both the administrative team as well as the primary caregivers who are going to be spending the most time with your person. If you can, maybe you've been invited to attend a lunch or a meal time there, try to sit with folks who are visiting their loved one and ask them about their experiences of this particular community. Asking about the kind of training that the dementia caregivers, nurses, and other staff have when they start and are being oriented, but also asking about ongoing dementia training, because we know that for professional caregivers to be effective, they're going to need some ongoing training, because yourself taking care of somebody with dementia requires a lot of skill, and they're going to need to have access to training as well. And look around at the residents. Do they seem happy for the most part? Do they seem like they're engaged? Do staff seem like they know their residents' names? Do they seem gentle on approaching them? And looking beyond the aesthetics is really critical. Look beyond the beauty of an environment that looks like a resort. That's probably more important to you than it is for the person with dementia. Does the facility and community have good training? Do they offer comfortable chairs that seem like they're stable for folks with dementia? Do they have grab bars and in their bathroom and in other places? Do they have a side rail just even in the hallway if someone's starting to feel a bit unsteady? Do you notice benches around where if people are wandering around the community and they get a bit tired, they have a place to sit? Is the lighting good? Take a look at that activity calendar and check the time of the activity and see if the activity is actually happening. And do those activities look like or seem to match the ones that your person likes? If your person has a particular game, maybe it's Mexican Train, maybe it's Mahjong, maybe it's a simple card game, do they have those things available? And if they don't, are they willing to consider making arrangements for a game like that to be available for your person? Are there specific medical needs that your person has that also need to be managed along with their dementia? Maybe they have hypertension, maybe they have diabetes, and they're going to be requiring injectable medications, or maybe they have Parkinson's disease and they're going to need medications kind of on time and right on time up to 4 times a day. One opportunity is to select a community that you like and use it in several ways to test the environment. It may be that if their census isn't full, meaning they have a few openings, that they offer some adult day programming that your person could try for the day to see how they respond to it. It may be that they offer some respite stay for a day or 2 or 3, and you use that as an opportunity to, 1, get some respite and take a break for yourself, but 2, to also see how they respond to your person there. If you're going to be applying for financial assistance through Medicaid or VA benefits, make sure that you select a center that accepts Arizona long-term care or whatever the Medicaid plan is in your community, or VA aid and attendant benefits, or your long-term care insurance policy. Because once those things kick in, you're not going to want to have to move your person, right? That's going to create stress for them if they've adapted to this environment and can no longer stay there if their funding source changes. So when you find a community and your person moves, it's not uncommon for that person to have a really hard time adjusting to their environment. In fact, we call that relocation trauma when, a couple of days into it, the person seems very anxious, agitated, upset, distressed. And this could be prevented if you contact the doctor prior to the move, or if there's a doctor on site that could provide a medication to prevent or even intervene if your person seems agitated. Often family members panic when this happens, and instead what they do is they do a drive-by and they grab their person and they take them home and say, this was a failed effort, it's never going to work. Avoid doing that. Give that person time. Think about how difficult it is for you when you're traveling to adapt to different hotel rooms. Think about your person who has a memory impairment now and how difficult it's going to be for them to adapt to a new environment. And this can take days, it can take weeks, so being aware of that. This is where it's a good idea to think about the visit. So, where a blanket statement of not visiting for a month is really not a good idea. But my rule of thumb is really that if the visit is distressing to you or to your person, that's a good time to end the visit and try it another day. If you're feeling exceptionally distressed, take a day off. Facilities really need to consider the needs of all residents, and while it's our job to advocate for only one person, be aware that when you visit potential facilities, listen for clues that the community is really demonstrating their concern for both your needs as a family caregiver and also for your person's needs. So how do you shift your role into that of an advocate? Well, it's important to really build an alliance with the facility and the medical staff there. You're now an integral part of your person's care team, and getting to know them is really going to be critical. Introduce yourself to them and let them know how you'd like to be introduced, right? So if you've ever had someone, a family member in the hospital, you probably made your presence aware to the nursing station, right? Because you wanted them to know that you're available should they have any questions on about your family member or friend's needs, but also so that they know that you are an advocate, you're a presence. Find out how the direct providers like things done and coordinated. If your person has specific preferences and you notice that maybe the staff aren't picking up on those, ask the staff how you can coordinate those preferences into their daily care. We usually recommend that you visit your person frequently over the first few weeks so that they get a comfort level in seeing you come and go, and so that the staff get to know that you're connected to your person. If your person is very upset about the move, maybe they're angry and frustrated with you, make that visit more about the task rather than a visit about talking. Bring their favorite snack. Bring a short story or a letter or even a prayer to read. Do something soothing for them, like putting on lotion that smells like lilac or brushing that person's hair. And if you're trying to keep your visit concise and you're having trouble figuring out how to do that, involve a caregiver. Go just before a meal or activity so that the staff can help you exit with minimal stress. It always feels like the focus is on things that aren't going well, right? Because this is an adjustment for everybody. It's an adjustment for the care staff to learn about your person. It's a huge adjustment for your person to try to, with memory loss, get adapted to a new environment. So things aren't always going to go perfectly smoothly. But as aware as you are of the things that aren't going well, try to find things that are going right and make sure that you verbalize those to the care staff, because then that balances when you have to mention something that needs correcting or isn't going well. So trying to insert yourself in the care team and make sure your presence is known by being assertive, but also being gentle and being aware that this is a facility and community that has a certain way of doing things, and you want to learn the steps in that process so that you can be part of it. So visiting can be stressful, right? And your job is to advocate for your person. You want to do something pleasant for yourself afterwards. Allowing yourself time to grieve after the visit. but also focusing on things that went well. Sometimes we feel very emotionally stressed by visiting, or we're still grieving the loss of the person at home and having a hard time accepting our own decision. So we're more apt to see that things aren't going well rather than taking a more balanced approach and trying to focus on things that are going well. Developing a rapport with the care staff. It takes time to do this, but it's really important. This will help you make them aware of your person's background, not just who they are in this particular phase of their life, but who they've been, what their background is, what their accomplishments are. Making sure that you're balancing visits with free time, redefining yourself as an advocate versus the primary caregiver. I had met with a spouse recently who placed her husband, and she told me that she was visiting 7 days a week, 8 hours a day. And so we had a conversation about how it is important for her presence to be known to her husband and to care staff, but also that she's not taking the respite as her husband is now being cared for by the assisted living staff, that she really needs to be able to offer herself some respite and cut back on the primary caregiver role and go to being an advocate and a spouse again. Easier said than done, I know. But making sure that your person, their likes, their preferences are known. Encourage your person to really get involved in some of the activities that are going on. Remembering that television and being isolated in their room is often going to cause more fear and illusions. Ask staff what you can do to enhance care. Anything from scented lotion to bringing your person's favorite shampoo or favorite treat. If your person really enjoys getting outdoors, consider that in a community that you're selecting that has a fenced outdoor area or courtyard. But making the staff aware of your person, who they've been, what their likes and preferences are, is really critical. And so this is a tool that has come kind of around the bend in many ways, shapes, or forms, but it can be used very successfully in assisted living community. This helps care staff know your person's life story, whether it's their preferred name, important people around them, routines, and of course things that bring them a lot of comfort. Knowing how to approach your person with difficult parts of care like bathing, and when they behave a certain way, what does that mean and how might staff interpret it? This is the time when your role as advocate is really important. You're helping your person adjust to a new setting while you're helping the staff know how to best care for your person. It takes time and patience. A guide like this can offer staff an opportunity to understand your person as a whole, who they were, who they are, and kind of what makes them tick. You could place this tool in, your person's charter record, but if it's somewhere that's really more visible and accessible to any care staff that might be working with them, like framed and posted above or next to their bed, or maybe even on the inside of a closet door or on the inside of their bathroom so that care staff can glance at it. Maybe it's a person filling in, but could really kind of get a quick snapshot of what is going to be most important to your person. Be aware of emotions. A change in residence or familiar surroundings can really result in anxiety, stress, and fear. It can create a change in that person's sense of independence. And in your role, it can result in lots of feelings of grief or loss. Leaving a home and familiar surroundings can really trigger lots of grief for that person, where they've left memories, possessions, sentimental tokens that can create lots of emotional changes for the person with dementia. Decreased responsibilities can often result in a feeling of relief for you as a caregiver. Often for the person with dementia, when they maybe were living at home, maybe they were living alone with care coming into them, but at times felt overwhelmed, a move to a residential community can really provide a lot more wraparound support and care that can make that person feel a lot safer and well cared for. It's very common for caregivers to feel guilt or sadness in changes in the role and a move to a long-term care community. It's not uncommon for families to not be aligned on what's best for the person with dementia, and it's often very common for one person in the family to have been carrying most of, if not all of, the care load. So be aware of your emotions. And be aware that you have a right to those emotions, and you'll have a need to be able to share those emotions, but not in front of the person with dementia if at all possible, because they'll pick up on those feelings of sadness or irritability or loss and really mirror that emotion. So try to be, as best you can, calm and positive about the move for yourself, for the rest of the family, and importantly for the person with dementia. So what do you do when you've been waiting an extended period of time for this person to settle in, but problems arise? What do you do? Well, try to be respectful, right? So if you're the primary caregiver and you have somebody else who is observing, you want them to offer advice, recommendations, or feedback in a very gentle way. Right? Recognize that a residential care community takes care of a number of people where you might have just been taking care of one or two. Know what the channels of communication are as identified by the facility. Right? So with any little change, you may not want to call the director of nursing or call the administrator. You might want to start with the care staff and then move up to the nurse, and maybe there's a charge nurse, and know the chain of command. And if you're not getting your needs met, start with the care providers and move up as necessary. Remembering that you know best that dementia care is very complex and communication can be difficult. But notice when you see a behavior that is indicating your person might be in pain or discomfort, or maybe has hunger or thirst. Be respectful. If you notice that staff just are too busy, you may want to communicate with a supervisor. Avoid pointing the finger and blaming. Instead, come seeking assistance for finding a solution for a better care option for your loved one, rather than just focusing on blame. Use the chain of command. If you're starting with the caregiver and then the nurse and the charge nurse, if you're seeing a long pattern of frequent or continuing problems, check in with that administrator. That person is really in charge of all levels of care and needs to be aware of it. If necessary, all facilities have written directions posted and are required to do so for filing a complaint. What you may want to consider is reaching out to an ombudsman or a case manager. Avoid threatening. Just remember that in most cases, people are really trying to do their best. Lost stuff. This is inevitably going to happen in residential communities. Lost items are typical. So this is a reminder that skip the designer clothing. Provide comfortable clothing that's easy to get on and off. Keep that good jewelry at home, those family heirlooms, the expensive diamonds. If that ring is really important to that person, look for or create a costume replica so that they can still feel a sense of comfort wearing it, but that you're not devastated if it goes missing. Label clothes if you're feeling like you really need to have a close handle on things. Take them home for laundering. But if a piece of clothing is missing, just remember it's probably being worn by another resident. It's not likely taken by staff. So avoid blaming. do ask staff to keep a close eye out for things that are expensive, that are necessary for your person's well-being. And even look for, if you know that your person tends to drop these things in the bathroom or in a toilet or a garbage can, to ask staff to keep a close eye on these things that often get put on a meal tray, like hearing aids, glasses, or even dentures. Integrating into the community. Many facilities have councils or support groups for families. Learn about the values and the norms for the community and the facility. Go to, community dinners or councils or support groups so that you can make friends with the staff, but also with other families. It really helps create connections and support. Look for and make sure you're also reporting staff behavior that is going really well or very supportive to your person. Keep a sense of humor. We know that elder care can be difficult. Look for ways to recognize or honor staff, whether it's at holiday time or another time in the year, just as a way to offer recognition. So during and after the move, just some tips that you should keep in mind. Be sure that a family member or caregiver is present during that move so that they can really help the person with dementia with the adjustment. Reassure that that person will be well cared for and that you're heading off, but you will be back to visit very soon. Visit on a daily basis for short periods and try to minimize those emotional goodbyes. Maybe bring in a special treat or activity when visiting. Beware of taking the person out too soon, even if it's just on an errand or to go to their favorite luncheonette. It may be better, as that person is transitioning, to bring their favorite lunch to them. Extra attention and reassurance can really help with the transition. Have a good relationship with those care staff and let them know that your person is new and is probably going to need some extra attention in the beginning. Remembering that people with dementia are going to need time to adapt. It could be days, it could be weeks, it could be a month or two. A new routine, new people can create a lot of challenge for that person in finding and adapting to new locations and a new routine. It can make them feel very frustrated and irritable, so be gentle and try to validate those feelings. If that person is voicing that they're very angry about the move, validate that feeling. Allow them time to grieve. This is where a medication that's calming can help with some of the transition, but it's not going to help erase feelings or confusion. So being aware that we need to give that person adequate time to adjust. Try to be positive. Put effort into making things work for that person. Again, being cautious about removing someone from that community too soon. Shift your role from primary caregiver to advocate. Try to return to being a husband, a son, a daughter, a partner, a friend, and make sure that you have an outlet for that emotional support that you're going to need, whether it's a support group or a close friend or a family member. As best you can, try to keep a sense of humor. Try not to take everything so seriously, and try to do things to take care of yourself. So advocacy and beyond, it's important for your role to shift to that of an advocate, and now shift back to something you've probably been neglecting for a long time. Focus on taking care of yourself. Make an effort to befriend other family members of the community. Make appointments that you've put off, canceled, or downright delayed for your own health and wellness. Try to return to activities that you've let go. Maybe it was your book club, or maybe it was a church group. Maybe it's an art class, or find new ones. Maybe this is a good time to take up yoga or an exercise program so that you can really seize this opportunity to take better care of yourself. Exercise, being more aware of your eating and how your food intake makes you feel. Practicing relaxation or mindfulness. Nurturing your spirituality, going back to temple or church, or just observing nature, doing things that kind of help you feel more connected and more peaceful, and allow you to really focus on increasing your own balance. There's a support group in our community which is called Life After Placement. It's a support group specifically for folks who have placed their loved one. So I'll end with a quote that I think is, really helpful to me when I think about caregiving. From caring comes courage and strength, says the Chinese philosopher Lao Tzu, who is the founder of Taoism. So think about opportunities to continue to support your person, but also find the courage to let go of some of the care and let your person adjust.
Thank you so much, Lori, for a really comprehensive look at a rather challenging decision that many caregivers do run into. We just have time for one question left in today's session. And I'm curious, I know you had mentioned there's a lot of different care options available, and there's different resources that you can tap into, but do you know of any that can help you identify where a quality facility is?
Oh, okay. That's actually an excellent question. So I mentioned that you could call the local area agency on aging or Department of Aging in your county. They have often have a helpline number that you can use. The Alzheimer's Association also has a national number, and their website is at alz.org. But in most communities, the Department of Health Services is in charge of regulating and monitoring and surveying assisted living communities. So often by going to the Department of Health Services website, you can locate an opportunity to look at different care facilities records, meaning how did they do on this year's survey and surveys from last year, to help you get a sense of how they're doing from a regulatory perspective. So that can also be a very helpful tool.
Okay, great. Thank you so much. I do want to thank Lori for your time this afternoon, and to all of our participants. I hope you found this to be a valuable lunch hour spent with us. I do also want to invite you to join us next month on August 16th, where we'll be discussing helping the person with dementia feel worthwhile. Thank you for joining our Dementia Dialogue this afternoon, where we bring the dementia education to you.